Hello everyone, I welcome you all to today's session on osteoporosis. I'm Dr. Aditi, Consultant Internal Medicine at Mehta Hospital, Chennai, and today we're going to learn about osteoporosis. So what is osteoporosis? Osteoporosis, as you're able to see here, is a condition characterized by significant reduction in bone mass. So as compared to the healthy bone, you're able to observe from this picture that there is a significant reduction in the actual bone mass. So what exactly is osteoporosis? Osteoporosis is a condition which is characterized by low bone mineral density, which is caused by altered bone microstructure, and this condition is very important because it predisposes patients to low impact fragility fractures, which in turn can cause a lot of disability and mobility. So what happens here? Osteoporosis is caused by an imbalance of bone resorption and remodeling, resulting in a decreased skeletal mass. Usually, the bone mass peaks around the third decade of life, and beyond the third decade, the bone resorption always exceeds the bone formation. So, when there is an imbalance in these processes of bone formation, bone resorption and remodeling, what eventually happens is osteoporosis. So, osteoporosis can be caused by two primary mechanisms, either by a failure to reach peak bone mass or by any condition which can cause accelerated bone loss. Both of these can result in osteoporosis. So, usually, how does bone modeling occur? Bone modeling occurs by apposition of new bone over the outer cortex. Now, as and when the bones are formed, the new bone gets deposited on the outer layer of cortex, and this is called bone modeling. And what happens in bone remodeling? In bone remodeling, there is a lot of repair of the micro damages which occurs, and through this process, calcium is delivered from the bone into the blood. So, we can find that in conditions where there is an increase in calcium demand, when there is an acute need for calcium, conditions where there is an acute calcium demand, what happens? There is an osteoclast mediated resorption from the bone and osteocyte mediated transfer of calcium. Both of this play an important role in bringing back calcium homeostasis. For example, there is an acute hypocalcemia. So, this is what happens. There is an acute need for calcium, and hence both osteoclasts and osteocytes work together to increase the movement of calcium from the bone into the blood. Now, what happens in conditions of chronic calcium demand? In conditions of chronic calcium demand, what happens is there is bone remodeling. Not only is there bone remodeling, because of this there is also bone loss, and finally there occurs secondary hyperparathyroidism. So, when there is a chronic calcium demand, essentially I mean conditions where there is going to be a long-standing hypocalcemia. So, as to improve this calcium level in the blood, there is secondary hyperparathyroidism and increased mobilization of calcium from the bone through processes like bone remodeling and bone loss. So, before we understand completely about bone remodeling, we should know what are the factors which regulate bone remodeling. So, estrogen, androgen, vitamin D, parathormone and growth factors like insulin-like growth factor 1, TGF-beta, PTHRP, interleukins, prostaglandins all play a very important role in bone remodeling. So, important things to remember would be the sex hormones, estrogen and androgen, vitamin D and parathormone. So, osteoblasts, we know, secrete two important proteins. One is the RANK-L, the rank ligand, which activates the rank in the osteoclast. Now, what is rank? Rank is basically the receptor activator of nuclear factor kappa. That is what is meant by rank. Now, this is present in the osteoclast and it plays a very important role in osteoclast maturation, development and differentiation. Now, osteoblasts also release another protein called osteoprotegerin. Now, this is a soluble decoy receptor of RANK-L and essentially works in an opposite manner to RANK-L by inhibiting the differentiation and function of osteoclasts. So, if we see here, the osteoblasts are responsible for secreting two important proteins. One is the RANKL, which activates the rank in the osteoclast, which actually promotes osteoclast development and differentiation. On the other hand, osteoblasts also secrete osteoprotegerin, which is a soluble decoy receptor of RANKL, and this inhibits the differentiation, maturation and development of osteoclasts. So, osteoblasts have a very tight control over osteoclast maturation, differentiation, development and function through these two proteins. RANKL, which promotes osteoclast differentiation, maturation and development, and osteoprotegerin, which essentially functions in the opposite manner to RANKL. Now, in addition to this, estrogens, calcium and physical activity also play an important role in regulation of rank and osteoprotegerin. So, what happens next? Now, what is the impact of osteoporosis? So, it has a significant impact on the quality of life because a decrease in the bone mass will essentially correlate with increase in the fragility of the bones, resulting in a lot of fragile fractures, which increase the incidence of falls, fractures and hospitalization. In addition, it can cause significant disability in the form of immobilization and having to become dependent on someone. So, data shows that the morbidity from osteoporosis ranges somewhere between 2 to 50%. Especially with hip fracture, in addition to the disability, the immobilization and all the morbidity that occurs from the fractures, specifically hip fractures can also predispose individuals to venous thrombotic events like deep venous thrombosis and pulmonary embolism. In addition, vertebral fractures can predispose us to kyphosis. Thoracic fractures can result eventually in restrictive lung disease. Abdominal fractures can also play an important role in causing constipation and early satiety. And about 5 to 20% of patients with hip fractures die within a year of surgery. So, osteoporosis plays a very important role because not only it affects the quality of life, it also causes significant morbidity, complications and mortality.